Welcome to The Better Life with Dr. Mariane Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mariane Pinkston.
Hello, everybody out there. This is Dr. Mariane Pinkston with The Better Life with Dr. Pinkston. And I have, it's the third Sunday of the month which airs Ray Solano from PD Labs. And so I get to welcome in my good friend after Father's Day here. Did you have a happy Father's Day, Ray?
I sure did.
Did you?
Yeah, I did. It was very relaxing.
Good.
That's the way I like it.
Well deserved. A day vacation out of, I'm not sure how many months or years you deserve vacations at this point, but
well, I appreciate that.
Welcome in. So, Ray, you are with the Compounding Pharmacy PD Labs up in Austin, Cedar Park, Texas, which is close to Austin. And you have been a great supporter of me over the last year, which I greatly appreciate. And we've talked about a lot of fun and wonderful things, but I think today you're going to throw me a curveball and talk about glutathione, but glutathione and pets. You're going to turn me into a vet today.
Well, you know, we've been talking about health of patients and being able to overcome viruses for the last 2 years.
Right.
You know, we're nationally licensed. I'm the owner of PD Labs, nationally licensed specialty compounding pharmacy, and we primarily focus on people and adults and children and seniors. However, we've realized, you know, everything, all drugs and everything we have comes from first use in animals.
Right.
And what we have found almost is almost by accident, and most drugs are by accident,
right, is
this unique molecule that your body makes itself in the liver. It's called glutathione. Mm-hmm. And glutathione is maybe a hard word to remember. However, it is your body's master antioxidant. Right. Okay, it's like your force field against all invaders. That's the way I have people just look at it. Is that when you're low glutathione levels, you're susceptible to viruses, to infections, because it's so important to neutralize all insults. And so allergy symptoms are the first crack in the armor, so to speak.
Right.
So it's very difficult in our diet. A Western American diet doesn't really have the building blocks so your body makes enough glutathione. Believe me, organ meats have been thrown out of our diet a long time ago.
Right.
You know, what we have to do is do something different to raise it up.
Right.
Well, you know, many practitioners like yourself have the ability of giving IV form of this special antioxidant. It's called glutathione IVs. Right. The problem is they only last about a couple of days for the effects because the body clears it so quickly. Mm-hmm. So it's important to how do you get it inside the cells? So you have these special forms called liposomal forms. You have topical forms, you have oral forms. However, studies have shown, and it's important to, you know, make sure you validate what you say, you don't really get it inside the cells so that the body is able to use it and regenerate it and make it a useful compound. So what we found is that using a little bit of chemistry and mastery, that's what pharmacists do. We get myself and Dr. Nayan Patel work over the last 10 years to really validate, to get a form that can get through the skin, because you can get things through the skin and gets absorbed right to the bloodstream very quickly and get into the cell. That's the absolute miracle that they developed under the book is called Glutathione Revolution, getting glutathione inside the cells.
Yes.
And you have miraculous recovery from viruses, and you have from also upregulates changes to blood sugar levels, which we have seen. So once you experience the miracle of glutathione, you really understand how powerful it is. But guess what? We found out that animals are very deficient, and they absolutely love the product, and especially cats. Cats is the most difficult animal to get any pharmaceutical into them or supplement or anything, as you well know.
Yeah, just like dogs, you just put it in a piece of cheese, it's over. Cats, you chase them up the fence pole.
Well, they all love the taste of this, and it tastes awful to humans. Believe me, I've tried it.
Right.
It tastes so. We found that the animals just love this, and animals do. We want to heal themselves.
Sure.
And so when all animals that have lesions, especially cats that have eczema and lesions, this works beautifully to fix the problems, especially animals that have aging joints and ailments.
Right.
Dogs. Right. So we found a product called, we renamed it Glutapet. How do you like that? Glutapet.
Glutapet. Yeah. Keep it direct. Keep it direct.
So we think that this is something for the whole family. You can spread it on the kids. You can spread it on grandma and grandpa, and you spread it on yourself, and then give a couple of squirts on the belly of the animals, and all of a sudden everybody's clicking their heels. How about that?
It sounds wonderful. And actually, I think you have available a skincare product that has it. I've been using it mixed with vitamin A and using it topically in the morning, kind of on my face, and so you've got several different products. And then Nayan Patel's product that you use on the abdomen, that's the one you're talking about, I think, for using with animals, right?
We do the Glutaril, which is used. You can put it on your abdomen, you can put it on the wrist, but it gets intracellular. It's the only patented glutathione on the market, right? And it actually gets intracellular. So don't even bother with some of the other products because they just don't work. And glutathione doesn't smell good. I mean, unfortunately,
has the little rotten egg smell to it.
But it goes away quickly.
It does.
Within
it's
a
not
few
bad
minutes.
at all.
So it's well worth it. In fact, many people, what you find is that it acts like a slow acting depot on the skin, so you get a little bit over time.
Right.
So it's a lot better than IV form, and so this is just a miracle. I think you try Glutaril is the topical form, and Glutapet for animals. Yeah. And so right now, the only thing we've been able to test it on is dogs and cats.
Sure.
So I think you're trying it as well, right?
I did. Yeah. My poor daughter has a beautiful cat, Teacup, that has a Teacup, who's had a terrible eczema problem for probably about 5 or 6 years now. She just chews at the back of her, just where she can reach on her back, and has yanked hair out of, watch this poor animal suffer. And so we are trying that with her now, and just started over probably about a week now. And she's using that, and we're going to see how this goes. And I'm looking forward to it. This poor cat is really suffering. There's so many drugs. I used to work for a veterinarian way back in the day, and we used to use Benadryl and started even using Prozac and things like that. Did a lot of different pharmaceuticals that, and don't try these things at home, please, folks. I mean, always check with your veterinarian, but something like this, completely natural, and completely good for the immune system, because eczema is an immune system problem. It's not just an allergy, it's an immune system dysfunction, and something like this can go in and help correct the immune system. So lovely.
Fix the problem. That's what we do. We like to get to the root cause of the problem, what the deficiencies are, and if there are certain key nutrients that are deficient, then why not replace it with those key nutrients?
Absolutely.
So, and this is something the body sees itself, and animals, it is amazing how they are always trying to heal themselves.
Right.
So there's, like you said, antihistamines is not natural. That's why they don't like it. They don't like many of the antidepressants that we give them. It's difficult to get to them. You have to put it on their ears, and you have to hide it in food and things like that, because they just know. But when they attach to this and they seek it out, you have to say, what is going on?
Right. So this is a potential use for joint problems, you said. Did I catch that right?
It ends up as an antioxidant. It stops that inflammatory cytokines.
How many people have you seen with, dogs with terrible hip and knee problems, can't jump up on the beds? And, of course, we're not offering anything that is just super cure but anything that will help would be absolutely amazing for some of these animals. They really suffer. They have a terribly high pain tolerance. And so if they're unable to move or jump or do something, they're in really bad shape. The hope is to find something that can work. How fast does it work?
Well, it usually works within a week. And what we're finding is it's liver. A lot of the older animals have liver toxicity that a lot of these environmental are concentrated in the liver, and this is what causes these joint problems.
Right.
So this goes right to that liver congestion and helps the detox pathways. So that's why it's so important. That's why you see all these products, these oral products that you say for animals. There's a lot of them have MSM in them, and it's a sulfur donor.
Yeah.
And these pets are just so deficient in things that help them detoxify and get rid of these pollutants. And so that's what we're doing, is we're helping the body heal itself. So I think this is just great. Right. It's not very expensive. Right now, we don't have a lot of data because we wanted to launch this as soon as we got a chance.
Sure.
Because once we have this in the household, we'll be able to get tremendous amount of information.
Right.
So we wanted to.
And something I spoke with one of your conferences not too long ago, and came across while I was researching for it, came across some data that says veterinarians are seeing skyrocketing numbers of autoimmune disorders now in pets and animals, as opposed to, we talk about it with humans all the time, but now we're beginning to see this rise in animals and pets. And so their foods are incredibly packed with, pesticides and grain-fed processed foods, just like we're eating, and the process of breaking down their gut, and so they're suffering some of the same immune system challenges that we're suffering now. And for that to be a fact, I hope that now, if it's going to get into people's animals and their beloved pets, that this will wake up people to the fact of what is happening to our bodies and our immune systems based on industrialized foods and whatnot. So something like this, I think, is an incredible addition, not only to humans, but safe and useful in animals as well, trying to hit that autoimmunity.
Well, you know what else you're missing? What happened over the last 6 months? Everybody went back to work.
Right.
So all the animals were upset, where is everybody?
Now they're under stress.
So they're all stressed out on top of it all. And
Poor
so
things.
it is unfortunately not a happy day for some of the pets. And
that's true.
So we really have to pay attention to them because, if you looked at the food aisles, there is more attention to the dog foods, cat foods for animals.
Right.
I've never seen so much inventory in all the stores. Yeah. Every single store, there's more. I think they pay better attention to the health of their animals. But boy, I tell you, you start throwing around healthy food for kids and for the family, you have an absolute revolt on your hands. So maybe we should start looking at the dog food and cat food. Maybe we should give it to the kids. I don't know. What do you think?
You know what? That is a great point, and I'm with you on that one. I am.
Grain-free.
They even have a refrigerated section now in the animal aisle, of refrigerated foods that are fresh. And you can get some of these fresh deliveries of fresh food for pets. And we can't apply that to our kids. We can certainly take care of our pets. Good point. Oh, it's amazing.
I know, we're always experimenting, but I don't know if I'm going to go that far.
Exactly. So, in the joint section, so what other use? So skin and autoimmunity, the joints, things like that. Is there anything else? And, that...
Glutathione helps with skin lightening and dark spots. And this is what we find. And it's also critical in antioxidant therapy for people that are undergoing cancer therapy. It can be used alongside chemotherapy.
Wow.
Therapeutics when you do if you injections along with, because the body is a strong antioxidant to get rid of the trash of dead cells that go through the body for these types of cancer therapies. So it has it's the body's master antioxidant. I encourage them to look for the book, The Glutathione Revolution.
Right.
Dr. Nayan Patel put a tremendous amount of effort into a very easy to read for everybody to see, and you'll understand the research behind it. There's a clinical paper that's being published on the use of glutathione, especially against many different types of infections, and also guarding against viral infections. So this is not something that we have just cooked up in a back room. Right. There is a tremendous amount of clinical data associated with it.
Very legitimate science behind it. And hopefully, I'm going to say it right now, Ray, mark my words, I'm going to get Nayan on this show. We're going to talk glutathione and market his book, because this is a great book. And I'm going to have this listed on the website so that folks can go and they've got you there. So pdlabsrx.com, which is where people can go. Tell me if I'm wrong, but they can go order the book from your site. Isn't that correct?
They can order from our site. We were giving away some free signed ones from our last event. Unfortunately, I think we're all sold out. Yeah. But
I got one.
If you want to give, oh, good. Well,
I got one.
If you would just give us a call on our 888-909-0110, we'll point you in the right direction.
Exactly.
But we just wanted to get the word out. On top of, you're taking pharmaceuticals, you're depleting glutathione.
Right.
If you're taking Tylenol, you're depleting glutathione.
Right.
So many of these drugs that we're taking, we're reducing our glutathione stores. Yes. And that's the worst thing that we could do. And especially, many people are getting many of the injections and COVID injections, and then they're also getting vaccines. And the first thing that they do if they get a fever is they take Tylenol.
Right.
So if nothing else, take aspirin, take anything but acetaminophen for reactions to these injections, because you do want to keep your glutathione levels up. You know what they give to Tylenol or acetaminophen poisoning in emergency rooms?
No.
They give glutathione.
Yes, well, actually I do, but I just wanted to
acetylcysteine.
Yes.
So
and acetylcysteine,
they raised glutathione to reverse the effects of acetaminophen. So this is not difficult.
Right.
We just have to apply what we already know.
Exactly. Well, I don't know if you heard that. That was the little alarm. That's for us to take a short break, because I wasn't even paying attention. We went a little over, but that's great. So give us a few minutes and we'll come back. We'll talk more glutathione. This is a great show. Thanks, Ray.
Hi, this is Ray Solano with your Healthy Choices Minute, sponsored by Prescription Dispensing Labs. New research has concluded that implementing dietary changes could prevent gut inflammatory processes involved in some chronic diseases. Modulation of your gut microbes through diets enriched with vegetables, legumes, grains, nuts, and a higher intake of plant over animal foods has a potential to prevent intestinal inflammatory conditions at the core of many chronic diseases. In short, the foods we eat in our dietary patterns have a major influence on our immune system that can cause many conditions we are suffering from today. Solution: try our OptiMeal shake. Our team has developed the best tasting, healthiest shake you've ever experienced to control blood sugar and to improve your gut. Start your day today with a healthy choice. Call us today at 888-909-0110 for a free sample of the OptiMeal shake. 888-909-0110. Remember, you have a choice in healthcare.
Welcome back. I am with my good friend Ray Solano this morning from PD Labs. And so anything we talk about today, you can find at pdlabsrx.com. And welcome back on the other side, Ray. We've been talking glutathione this morning. And what else do you have in mind for us today?
Well, I think it's really important. We're seeing a tremendous growth in people taking charge of their health.
Right.
We call it the consumerization of healthcare.
Yes.
That if you just look at commercials, I watch TV just for the commercials. The clinical data that is giving out for these drugs that are these biologicals and injections is mind-blowing.
Right.
That we're educating the consumers on pharmacology. Okay? Not just we're going into detail on the pharmacology of drugs. Yeah. So I realized that we're having a hard time for people to take the wrappers off of suppositories before they use them. So I'm just trying to understand, what are we doing here? So I'm not there that they can understand this. I'm having a hard time. I've been doing this for 20 years, and I'm trying to keep up as well.
Same.
But it's really important to get a team like yourself and us to really give people a choice in healthcare. Yes, they don't want to settle for.
Right.
But you need to be able to ask questions and use some common sense. Right. Am I ever going to get better? Right. Am I going to, how did I get there in the first place?
Right.
What can I do to fix this, to get back to my life? Those are some hard questions. And if you don't get those answers and all you do is taking more drugs, I think you keep on looking.
Right.
And I think that's what we've done together. We've got some unique tools and software, metabolic code that helps really be able to fine tune what is causing the root cause of the problem, and how do you reverse 20 years of neglect.
Right.
And so your practice has done a great job of teaming with specialty pharmacies like ourselves and other physicians to educate people just to get better.
Exactly. People are I can't tell you how many times a day I hear it, Dr. Pinkston. I am so glad you're out there. I was so tired of sitting in front of my doc who's on a computer, almost their back turned to me.
That's right.
5 minutes, prescription, I'm gone. People are done. And the trust level has absolutely plummeted as far as, what people trust in medical care these days. In fact, sometimes it's a visit or two before I overcome that. People are so almost defensive and closed off to the opportunity. They feel like I'm just going to treat them the same way they've been treated for so long. And I know I was in that same system as part of why I practice the way I do, because I fell into that, being treated that way. And it's a miserable, horrible place to be. So I'm glad people are waking up to it. I just hope that the ability to read more and more about their conditions and what they're learning doesn't overcome the fact that we're still specialists in this area, and we still, I invite your ideas and your questions, but at the same time, let me practice what I practice, because I do know things in a more in-depth way. Not to say I'm smarter than everybody else, I'm not, but, I find sometimes people will, trust Dr. Google more than they trust me, and that's such a shame. I think it's medicine's fault, doctor's fault for building that kind of distrust. So I get it very much.
Well, it's a purpose.
Yes.
It's a purpose there.
Yes.
It's to mistrust, but to educate them on different drugs.
Right.
And so they start shopping practitioners for drugs.
Yes.
That they think they've been told, because you got tremendous marketing behind this that will convince you of anything. I've never seen so many drugs that people will have to take injections for
the
on a daily
biologics.
basis. Have you seen? I mean, it's just
I have.
Wait a minute. We're going to have people taking 3 or 4 injections
for
at a
heart
time.
disease, for psoriasis, for eczema, and for asthma, and Crohn's disease, or GI problems, and there's so many. It's all biologics now, which I know. With my terrible rheumatoid arthritis, I've been on 12 different ones, And it is, it's insanity to listen to the commercials. Oh, you see the happy people dancing, everything's fine and great. And then you listen to the fine print underneath, and it's, your eyeball is going to fall out, and, you might develop all these cancers, and, it's very frightening. And so, yeah, it's a tough sell that they've got. Most patients really are very leery now, and I'm glad. They have a place. Believe me, I said I've been on 12 different ones. I have a very severe disease. I do a lot of things to take care of myself underneath. I do a lot of things, through you, through compounding pharmacies, through my physician who's very integrative, has a very integrative slant. But, the disease is the disease. It's the horse is out of the gate, so to speak. So I have to do something. But it is nice now, and what you were saying earlier about choices. People do have choices these days.
They have choices.
Wonderful.
Your choices in food.
Absolutely.
And it all starts with the food we put into our bodies.
Absolutely.
And yes, it can be a little difficult and restrictive at a time.
But it's worth it.
You know what? I'd rather start there. That's what we've done so well on the Metabolic Code program is we understand most of all the diseases start in the gut.
Yeah.
In the GI tract. And once we fix that area, it seems like the onion gets peeled back everywhere else. I mean,
and things get so much better. And
especially with children, the foods that we give these children, your mother and your grandparents would never have allowed that.
Right.
And so that, it is something that's so basic. And you have so many choices. And guess what? I think all these processed foods are extremely expensive. So I think hopefully now, since everything's expensive, maybe they'll go back to the basics.
Now they are with gas and everything else. And you know what, Ray? We hit the end of our 7 minutes there. And it always goes so fast. And I enjoyed talking with you so much. I want to make sure everybody knows where to find you and to find me. So you can go to pdlabsrx.com and find so many wonderful things that Ray and I have talked about over the last year. You can also find Ray and me at drpbetterlife.com. And that's where you can find YouTube and all the platforms, as well as being on San Antonio Radio. And I thank you guys for joining us. Thank you, Ray. Have a great
thank you. And next
week.
time we're going to talk about our new product called Mitoline. I'm going to get Dr. Capazzo on the show as well.
Good.
It'll be amazing.
Let's do it.
Mitoline is coming soon. How's that?
That's awesome. Thank you as always. Okay. We'll see you guys.
Take care. Bye-bye.
Bye-bye.